So I think about 5 or 10 million people or something a year die of dengue fever. And you're seeing it probably more than anybody, that as people change their diet, the stem cell physiology starts improving. These glands are then repairing and rebuilding themselves, and then they start producing those right levels of hormones, which then brings that body back into balance. Any time that you do, like all the powerlifting that you do, as you're lifting weights, you're damaging muscles, and those muscles are sending out the signal to the bone marrow. Just by doing strenuous exercise, you're actually increasing your circulating stem cells.
Okay, let's get started here. We've got John Kennedy again, who's returning. He is in Kiwiland, New Zealand. So, John, it's good to have you back again. You've got some more information for us. So, I guess just for the people that have not heard of your previous podcast or are unfamiliar with you, a little bit of background on who you are. We have a president that was named John Kennedy, but it's obviously not you.
Yeah, no, not me, not this time round. Yeah. So my background, Shawn, is that I'm an acupuncturist here in Masterton, New Zealand. I've been in clinical practice for 23 years, and during that time, or during my study, I actually went to Sri Lanka and worked in a hospital over there. I got bitten by a friendly mosquito, ended up with dengue hemorrhagic fever, and I had some quite bad complications from that over the pursuing 8 years. And I did a lot of stuff to try and get myself better. Did various types of juicing, nourishment supplements, saw all the specialists. Didn't really get any resolve until around about 2007. So I got better then. So that was about 8 years of illness. So I've been basically in clinical practice since 2000. And just ran my own clinic and have seen thousands of people over those years.
So you mentioned you got dengue fever. That's not something that most Americans are familiar with. It's not endemic in America in any stretch. You certainly see it in different parts of the world. But what is dengue fever? How did it manifest itself in you, and what was the course, and how did you get over it?
Okay, so with the dengue fever, it's born from a mosquito bite. It's a parasite or something that gets into your blood. High fever, aching bones, diarrhea, vomiting, all of that. And if it progresses to a certain level, what happens is that it can affect your levels of platelets in your body, where you don't actually clot anymore. I think about 5 or 10 million people or something a year die of dengue fever. Lucky enough, I wasn't one of them, not that time round. And I just had these real chronic sort of symptoms from that. Really sore bones, achingness. My digestive system was completely destroyed, really, because I had about 8 years of chronic diarrhea with blood, mucus, undigested food. I got diagnosed with all the irritable bowel and Crohn's and you name it, and I had the label. And so, just really bad digestive stuff from that. Now, I don't actually know if that was from the dengue itself or whether that was a complication from the actual medications that I took as well. But I started to get like a rash on my chest when I went into hospital in Singapore. Yeah.
You mentioned medications. What is the typical treatment regimen for dengue fever?
That's basically, they keep you hydrated. Because of all the sweating, the vomiting, and the diarrhea, there's no actual treatment for it itself. You just got to hydrate the body and make sure it doesn't go into shock like that.
And so with often the thrombocytopenia or the low platelets, do you have issues with like hemarthroses and stuff like that? People bleed into their joints and bleed through their digestive system. Is that pretty common?
That they could do, I don't know. I really didn't follow up the dengue too much at that stage. I just got home and just had to, because my health was so bad, I just wanted to just keep going and get through day to day. So I didn't really go into the ins and outs of it, but I never had any of those other things. I was diagnosed a few years later with Gilbert syndrome. And apparently that's a congenital problem or genetic problem that can stay dormant for your whole life. But then through an illness or severe stress or something, it can get triggered. And the Gilbert syndrome is where your liver can't process your dead blood cells properly. And I had a number of symptoms.
You end up with a little bit of elevation in bilirubin, if I'm not mistaken. Is that correct?
Correct, yes.
Yeah, and I think I've read somewhere that Gilbert syndrome actually confers some level of protection for some issues, and I can't remember which they are off the top of my head, but I know there's an interesting thing, but it actually confers a protection in some way. So it may have been selected for as a genetic advantage in some situations, just like we see with sickle cell anemia, where it's protective from malaria. And so that's why we often see it in people of African descent that are in malaria endemic areas. So you have some pictures. I think you had some slides showing you with your pre and post dengue. Yes. Do you want to share any of those, or is there? I guess I know there's some thought around. Well, I know the conversation. I know we talked about acupuncture in the past. You've used nutrition, and there's maybe some thought around stem cells. But I guess I'll let you take it however direction you want to take this.
Yeah. Okay. So I just got a couple of before and afters. One of them is before and after having dengue hemorrhagic fever, and then one of them is before and after carnivore. Because there's a few years of good living in between there. So I'll just come on here and just share the screen. And then once I've done that and just shared that, what we can do is I can go into, I've got a little, like about a 10 to 15 minute presentation about what stem cells are, what they do and how they work. Because it really does explain why so many people are getting better with their health in the carnivore diet. Because if you've got something that helps support stem cell physiology, then you're going to see a wide variety of benefits over a wide variety of conditions. And I think it's really quite good for people to see what's actually going on with that.
Yeah, I'll share a little interesting anecdote you might find interesting. So recently I injured my neck doing jiu-jitsu, and I ended up with a disc herniation, which it manifests itself as a radiculopathy. So I've got this C7 radiculopathy from a herniation between C6 and C7, which is where the anatomy, that makes sense with that. And that's been slowly getting better and so on and so forth. But just as a weird sort of incident, Joe Rogan, the famous podcaster, noted that. He saw that I was having neck issues, and he said, hey, look, I'm going to hook you up with some stem cell people and let's go do a podcast while we're there. So I'm flying down to Austin in about 10 days, and apparently I'll undergo some stem cell treatment and also, of course, do a podcast with him. So I'm interested. I'm curious to hear about your stem cell presentation, because my initial thought around stem cells is I think maybe it's more hype than reality. I know the American Academy of Orthopedic Surgeons, at least the last time I checked, was not really all that sort of big on stem cells, saying that it lacks efficacy. The data is, inconclusive. But maybe there's been some more updates, and so I'm interested to hear your presentation. So that's my little disclaimer. I'm a skeptic, but I'm happy to be educated.
Yeah. And as you'll see as I go through this presentation, you'll see that there's quite a big difference between the introduction of exogenous stem cells, ones being added to the body, versus ones that are already present in your bone marrow that use your normal physiology to actually repair the damaged tissue. So we'll go on, and it might just take me a second to make sure we get the right slide here, the right thing here. Okay. So just go here and just turn this here. Yeah, so here I am, pre-dengue hemorrhagic fever. And
got a nice smile on your face. Is that in Sri Lanka or is that in
that was in Sri Lanka.
Okay.
Yep. So I was working there with two of my classmates from my acupuncture college. So we were there doing that. And then this photo is, I think, about 3 weeks later when I got back to New Zealand.
So like you maybe lost some weight and you look sad.
Different scenario altogether. Hair grew a little bit. But yeah, I lost 12 kilos in 9 days. And then when I got back to New Zealand, because my gut wasn't working properly, I ended up actually losing about another 10 kilos after that. 10 kilos, I think, is about 25 pounds, thereabouts. Yeah. So I lost about 50 pounds altogether over that time. Now, when I got better in 2007, I had a few years of really good, healthy living, and I don't run around taking photos of myself all the time. But in July of 2020, I had an injury to my right shoulder, and I blew out my AC joint and moved my collarbone up onto my sternum and broke a few ribs. And as a result of that, in 19th of December, I had a surgery on my shoulder. They cut the end of my collarbone off and left a gap in between the acromion and the collarbone. And so I was like that. So there I was 96 kilos. That was me there the day after my surgery.
What's all the red? You got a little bit of bruising or something up and down your chest.
Yeah, that was the stuff that they put on there for the actual suit. I
used to do this surgery all the time. This is called a disc clavicle resection done on arthros. Looks like they did it open for you, so you get an open incision rather than an arthroscopic procedure. But
so they did a lockdown procedure where they put they tied a little strap around
around your coracoid.
Coracoid process, then up over the collarbone.
Yeah, I've done that. I used to do those too. When you suck it back down, you take a piece of graft, usually allograft, and there's different ways to secure it, but you just crank it down so it stays. So that makes sense why it's open. Okay, got it.
Yeah. So that was that. And so that was me December. And then I said to my wife, I says, look, 1st of January, hey, let's go carnivore. And she goes, okay. And I just about fell over. So that was really cool. So she was keen for that. So we went carnivore, and here I am here. Got a bit of the belly, the double chins going on, and just.
How old are you on that picture?
That there, I am 50 years old.
50 years old. Okay. That's when I was carnivore. I was just before I turned 50. I was 49 when I did that. So interesting. It's good that your wife supports you. That's great. You gotta keep her.
So that's really cool. and I got this next photo just to illustrate one thing, is that it's really about that old saying, you can't outrun a bad diet. Okay, and I said that last time I was on your show. And what this goes to show is that here's me, April the 6th.
Yeah, so that's
okay.
3 months later.
Basically 3 months later, 3.5 months, or 3 and a bit months later. Yeah. Okay, I had my surgery. I sat on the couch watching Netflix and YouTube. I did zero exercise. The only thing I'd done was change my...
Yeah, and it's interesting because clearly you've lost fat, but to my mind, it looks like you might have even put on a little muscle. It's interesting because it looks like you got a little more pectoral development, maybe a little bit more in the shoulder and the arm, but interesting. Yeah, so clearly without exercise, you've done some level of... You've certainly lost fat. That's inarguable, I think.
Yeah. So
what was the difference in weight there? Do you remember the weight difference?
So I was down to 81 kg. So I think that's about 180 pounds or 179 pounds or something.
160, 162 plus 16, 178 or something like that. What did you weigh prior to?
And prior to that, I was 56 kilos.
Oh, wow. So 30, that's 33 pounds. Yeah, that's pretty significant. Yeah.
Yeah.
Okay. So, wow.
So that was, there was a huge difference there. And as you saw me just standing there before live, I haven't put any weight back on and just been cruising along now. So 53 now, 54 in January.
Are you exercising at this point? Do you do any of that now?
Not really, not at all. I'm just mooching around the house, going for walks with the dog and things, doing a few squats, just body weight squats, but nothing really in my upper half of my body, because what's happened is that the gap between the acromion and the collarbone, where they did that resection, that was supposed to fill up with scar tissue and stabilize. But whereas mine's got like about almost an inch movement between the collarbone and the acromion.
Yeah, so maybe that because they reconstructed the coracoacromial ligament, and maybe it failed. Maybe they just didn't. Maybe technically they didn't do a very good.
Yeah, so they didn't do that very well. And also the medial end of my collarbone is still sitting up on top of my sternum. And when I just do little movements with my shoulder backwards and forwards, my collarbone moves backwards and forwards across my sternum. And I haven't been offered sort of any surgery for that as yet.
That's a tough one. Those medial clavicle ones. There's not a lot of surgical treatments that typically done with that. And how did you injure it? What was the injury initially? Did you fall off a bike
I actually bought an electric scooter that sort of rides like a skateboard. And it was really great. It went up to like 55 kilometers an hour, or just over 30 miles an hour, and had this like big range on it. And I was just going on my way home for lunch. It had two wheels at the front and one at the back. And I bought it for its stability and that, because I knew that I couldn't afford to get injured. Yeah, famous last thoughts. And I was just coming home for lunch one day through a park, and I was going about 20 miles an hour, and the bolt holding on the front left-hand wheel snapped. And as the front of the scooter went down, it dug into the ground, and I got catapulted off over the handlebars, and then landed on my right shoulder, took all of my weight, and basically that was the end of that.
Ouch, ouch. Did you let the manufacturer know that, hey, the thing broke?
Yeah.
Just about killed me.
Yeah. So I got a full refund and was still allowed to keep the scooter, but I fixed the scooter and then sold it pretty much straight away. Because, you know, that whole thing about if I'd fallen off just because I was being a fool, then, yeah, I would have got back on it. But because it was like a breaking of a part of it, you know, you just lose that trust in something. Yeah. And so, you know, I got rid of that.
All right. So Carnivore, you've survived dengue fever, you survived the scooter crash, and now you want to share something about stem cells. Or you have something else you want to share? Yeah.
Yeah. So stem cells, we're talking about the adult stem cells, and these are your adult stem cells that are found in your bone marrow. Okay, so what these stem cells do is that they can duplicate themselves. So when a damaged tissue needs a stem cell to help repair itself, it sends out a signal to the bone marrow, and that stem cell in the bone marrow will asymmetrically divide. One stem cell stays in the bone marrow and the other one goes out into circulation, where it comes in contact with other tissues, other cells, and then differentiates into those different types of cells. And so I've got a bit more of a graphic about how that actually works. So we all know that every day we're losing millions of cells. So our eye cells, our macular cells live for about 2 to 3 days, and then they die. Gut cells, 3 to 5 days, then they die. Our liver cells, 6 to 7 weeks, they die. Kidney, lungs, and heart cells. They've all got a limited lifespan. And to give an example of our cellular turnover, is that we get a new intestinal lining about every 5 days, a new liver and pancreas every 3 to 5 years, and we get a new heart and new lungs every 4 to 5. Some research shows that the heart's could be 4 to 6 years, just depending on what's going on. So if these stem cells are doing this, how do they actually work? We've got these different tissues in the body, different organs and different glands and muscles and things. And when one of those cells gets to the end of its lifespan, it says, I can't divide anymore. It then sends out a signal called GCSF. And that sends that signal out to the bone marrow to request stem cells to come and do some repair work, because it needs that cell to be replaced. And at the same time, it puts a little adhesion molecule on the side of the capillary that then attracts that stem cell to it. So once the bone marrow receives that GCSF, those stem cells divide, and then they come out into circulation. And when they find that little adhesion molecule, they then migrate through the capillary into the tissue, and they switch on the gene, and they become a brand new healthy cell of that organ or tissue in the body. So that's what our body's doing every single day. And the same for an injury. If you hit your thumb with a hammer, those damaged cells are going to send a signal to the bone marrow. Bone marrow is going to release a stem cell, and that's going to travel through to that area, and you're going to get new skin, new ligaments, new blood vessels, whatever your body needs in order to repair itself.
Let me just interrupt you here, because so we've got these dedifferentiated stem cells which are residing in the bone marrow. They're released into the vascular system at the request of whatever's been damaged or has expired. And then I guess this gets into aging and that type of thing. So as we get older, do we have less stem cells available in our bone marrow, or do we have just such a tremendous amount of damaged tissue that it can't keep up, or is it some combination of the both?
It's really the first one where our bone marrow, as we age, gets stickier. And that comes up in 2 more slides.
Okay. I'll be
So
patient.
we'll have that answer for you right there. Okay. So our cells and our body has this thing called an environment, and the environment in which our cells live in. Now, if anybody out there knows that they own an aquarium, when they've got a sick fish, you don't treat the fish. You treat the aquarium where the fish lives. And that's like the cells of our body. If we think of our body as the aquarium, the cells are the fish. And if the balance of chemistry within our body gets out of whack, then the cells don't work the way they should do. So the same thing where I was talking about before with the heart, the liver, the lungs, the kidney, being physical repair of that, stem cell physiology works at a much deeper level as well. We've got the different glands in the body that produce the different hormones. And if those cells of the glands die off without being replaced, they don't produce the right levels of hormones, and our environment changes. And therefore it can become hospitable for bad tissue to grow, for other viruses, other things to live there without being sorted out. So again, the glands send out the signal. It's the same process. The bone marrow releases those stem cells, and then those stem cells turn into the tissues that create these hormones. Stem cells can't turn into insulin, but they can turn into insulin-secreting cells in the pancreas. They can't turn into T3, T4 thyroid hormone, but they can turn into the tissues or the cells that produce those hormones. And same for Parkinson's. The stem cells can't turn into dopamine, but they can turn into the cells of the substantia nigra that produce dopamine. So this is where we're seeing, and you're seeing it probably more than anybody, that as people change their diet, the stem cell physiology starts improving. These glands are then repairing and rebuilding themselves, and then they start producing those right levels of hormones, which then brings that body back into balance. As you can see, I'm only slightly passionate about it, but it's like one of the most incredible systems that we actually really have in our body.
If I'm just curious, because if I were to take a bone marrow biopsy of, say, a 90-year-old, I would probably get a certain amount of functioning dedifferentiated stem cells versus if I were to take the same biopsy on a 5-year-old kid or something like that. I assume.
Correct.
Do we have data on that, like the magnitude of difference in the stem cell concentration in a normal bone marrow aspirate on these two different age populations?
Yep. Those are definitely there, but one of the things that has been done that I know of quite readily is that as we age, stem cell circulation decreases. So if at the age of 20 years old, our stem cell release rate is said to be 100%. You can go out, you can play rugby, football, you can do whatever you like to yourself to a point, and basically you'll recover within a day or two because you've got lots of stem cells. They go out and they'll do all the repair that your body needs. By the time we get to 50, that stem cell release rate's down to only 50% of what it used to be. You go out and you hurt yourself, and it takes longer for that repair to happen. And then just 15 years later, at 65, our stem cell release rate's down only to about 10% of what it used to be. That's that slippery curve that goes down. And so as we age, our bone marrow gets stickier. It goes from, I forget the colours, it goes from red to brown, I think, or whatever it is. It starts slowing down, so it's not releasing the stem cells in the same rate as what it was.
Yeah, I think the marrow becomes more, it's very red, and then it becomes more yellowed, more fat containing, maybe less cells available.
Okay. Yeah. And also other things like lifestyle can reduce stem cell release rates as well, like stress, sleep, toxins, illnesses, too much or too little exercise, poor diet. And just something on the whole stress thing is that there was a study done that about couples that had arguments where someone became injured if that person or if that couple made up after the argument, they healed faster than the couples that didn't make up after the argument. So if you're able to release your stress and get back to a normal emotional state, your body will actually heal. So you see people that are really super stressed and they age quite quickly. It's because that stress is causing their bone marrow to hold on to their stem cells, so they're not repairing at the same rate they should be. And so that's quite an interesting thing to see there. Less circulating stem cells can result in slower recovery rates. Because if you damage yourself in any way, shape or form, have an operation or anything like that, you damage some part of your body, if that stem cell physiology isn't working properly, you're going to have lower numbers of circulating stem cells, and therefore it's going to take longer for that process.
Is there obviously, you said stem cells are originating in the bone marrow for the most part. Is there like a standard blood test where you can say, hey, this is how many stem cells I have in circulation at any given time? Is there like a standard reference range? And then, of course, you would expect in a healthy person, an injury would generally cause those to go up, assuming they're getting the correct response. Is that something that people have access to?
Yeah, there is a blood test that can be done. Now, when I first came across stem cells and stem cell physiology as an interest about in 2007, I talked to my doctor about it and says, hey, look, can you measure my stem cells? He says, yeah, we can do the test, but it's going to cost you $1,500. And that's New Zealand dollars, which is about slightly half of the US. Whether you can, it is a test that can be done. So you can measure your circulating stem cells. And they do vary during the course of a day. But it's been noted that marathon runners and ultramarathon runners, they have an increase in circulating stem cells. Any time that you do all the powerlifting that you do, I don't know if you call it powerlifting, but the lifting that you do, as you're lifting, which you'll see in a couple of slides, which is like really cool, as you're lifting weights, you're damaging muscles, and those muscles are sending out the signal to the bone marrow. So just by doing strenuous exercise, you're actually increasing your circulating stem cells. And if they all go to those muscles, that's fantastic. But generally, if your heart, your liver, your lungs, your kidneys, your internal organs, because they're always, your body will sacrifice your limbs in order to save its internal organs. Like when people go out into frozen environments, you'll get frostbite, you'll lose your fingers, your hands, and so on, before your body will actually shut down on its organs. So if you're doing physical exercise and releasing more stem cells, then it only stands to reason that they're not all going to go to the muscles. Some of them will ultimately go to your internal organs to help them repair as well.
Interesting stuff.
Yeah. So less circulating stem cells can also result in, of course, the development of illness. So with MS, everybody's myelin sheath is basically dissolving. But because the majority of people have a good stem cell physiology, that myelin sheath is being replaced. And if you improve stem cell physiology, you start seeing stem cells working better with people with MS, and you start seeing reduction of symptoms. That's there. The brain, with the guy who was talking about reversing Alzheimer's and things with the aged care facility, I got really excited hearing about that because I've known about Parkinson's and things, that the substantia nigra in your brain that produces dopamine, that can deteriorate by 80% before you show your first symptoms of Parkinson's. Okay, so that's a significant amount. Now, one of the things that we have seen with Parkinson's is that my theory, just as an example, a visual example if you like, is that if that gland can deteriorate by 80%, what Western Med does is they come in and they inject stem cells into that gland. Stem cells switch on the gene and they become dopamine producing cells. And the symptoms of Parkinson's basically, they go away, they reduce significantly. We all know, I think, quite reasonably is that nothing happens in isolation in the body. So that gland might have deteriorated by 80%, but there might be another cascade gland prior to that produces a different hormone that sets the scene. That gland might have deteriorated by 30%. And there might be another precursor gland to that might have deteriorated by 10%. So when they're doing the stem cell injection, they're only doing it into one gland, the gland that is responsible for the end result of that condition. Whereas when you help support your own stem cell physiology and you increase the communication with your stem cells and the damaged tissue, your own stem cells will go to that 80% gland, the 30% gland, and the 10% gland, which ultimately gives you a better outcome. Yeah, it's going to be slower, but at the same time, it's affecting not just a symptom, but the regeneration of the body as a whole.
Yeah. So let me ask you, if we have circulating stem cells and maybe they're in excess for some reason, maybe we've injected somebody, and I've seen something like intradiscal, say you've got a degenerative disc in your spine and they inject it, and if it leaks out, then it can sometimes develop osteophytes, which would be a problem because you're growing too much bone in that area. So how does the body regulate? Obviously, there's got to be cytokines and other chemical messengers that tell these cells when to develop, how much to develop, and when to stop, correct?
Yeah. So our body works on a supply and demand system. If there's damaged cells in the body, they're sending the signals out to the bone marrow, and then the bone marrow is releasing the right number for that to then come out and do the repair work. So in nature, our body just wants to repair itself, and it's developed a system where it will actually do it. When you come to injecting and adding in extra stem cells, then that's where things can, as you say, go awry, where your body starts doing something because you're forcing your body to do something that it doesn't normally do. You can't just magically say, oh, I've got a bad elbow, I want an extra, because consciously as a thinking being, oh, I want an extra 1 million stem cells there. We can't do that. Our body will regulate the amount of stem cells that go to a certain area in order to repair that tissue that's needing repair in that area.
So among your sort of factors that limit or, I guess, optimize stem cell, you had stress, sleep, exercise, so on and so forth, and then you had diet in there. So I guess eventually we'll talk about how does that impact the availability and the function of the stem cells. Yeah.
And so there are different, when we're looking at stem cell physiology, there's a couple, or there's probably many different factors. But the main one is like the releasing of the stem cells from the bone marrow. There's the trafficking of them through the system. So think of this. Let's say you're at home and you break your leg. Okay? You're at home, you break your leg, you ring up 911 and you say, hey, it's John here, I've broken my leg, I'm at 123 Fake Street, it's nighttime, I'll leave the porch light on, can you send an ambulance? Okay, so that's your stem cells doing their work. And then the dispatch releases the ambulance, it drives along, it sees the porch light on, comes up the driveway, it fixes your leg, and you're saved and you're repaired. That's fantastic. So that's the way we want it to work. But what happens is that when we're having like other sorts of foods, again, this is a few slides further back, but we'll get there in due course, so you can see this visually, is that if we ring up, if we fall over and break our leg, and we've got a lot of inflammation in the body, or plant toxins or oxalates or whatever may be going on, then when you fall over and break your leg, that dying cell, it goes to ring the 911, but there's a lot of static on the line. I'm just broken leg, Fake Street, light. And so there's not a clear signaling happening. As that message goes to the bone marrow, it's, oh, do I need to release a stem cell or not? And if it does release a stem cell because that part of the signaling is okay, if the other part of it is not okay when the stem cell gets released and there's inflammation or whatever it may be going on in the body, all of a sudden it's like the ambulance is driving along, but it's pouring down with rain and it's nighttime. And it's driving along and it just drives straight past your letterbox. So that stem cell will just keep circulating around until it finds that adhesion molecule, until it finds a light on a porch to go in and migrate and repair. So that sort of gives that idea about what can happen in stem cell physiology. So is it the signaling from the damaged cell to the bone marrow? Is it the bone marrow is that we're older, we're not releasing enough stem cells the way we used to in order for need? And then, or is it the fact that we're not actually, the stem cells aren't able to find what's going on? Now, you've actually just reminded me of a really good example of this whole stem cell physiology thing. And when I do talks on this, I ask the audience, I say, put your hand up if you know of an elderly person that was really quite healthy, but once they fell over and broke their hip, everything else started to fall apart. And numerous hands go up. And I said, that's exactly what stem cell physiology is that these elderly people, they're releasing enough stem cells to maintain a certain level of health. They fall over and hurt themselves. So there's all of a sudden a big increase of demand for those stem cells to go to that damaged area. And once they start going there, that's at the sacrifice of the heart or the lungs or the, whatever it may be. And that's where people go, I was getting along so well, but once I had that fall, everything else is falling apart because they didn't have enough stem cells to maintain that optimal level of health that they had and fix that acute injury that came into the body.
Makes sense. So there's only so much reserve, physiologic reserve that you have, and an additional stress is.
Yeah, exactly. So here's just a little bit of research on what some adult stem cells do. So bone marrow stem cells can form liver, skin, and digestive tract cells. So from the New England Journal of Medicine, bone marrow-derived stem cells have also demonstrated the ability of renewal of the pancreas. Mobilized stem cells being used in renewal of the cardiac tissue. Bone marrow stem cells have shown the ability to participate in the renewal of the retinal tissue. And bone marrow stem cells have also been shown to contribute to Purkinje cells. Now, these are cells in the brain that science had believed didn't generate after birth. So your stem cells, just in those couple of little examples, your stem cells really do have the ability to repair and regenerate your tissue on demand, providing we're not stuffing everything up by a lifestyle that's unsustainable. So here's a couple of things. So the question is, does improved stem cell physiology make a difference in real life? Now, I've seen this happen. Macular degeneration, this is someone's a number of months later, because there's a couple of Chinese herbs and some other plant extracts that have been clinically shown to actually increase your circulating stem cells. And so what we've seen is this sort of thing happen when people have used those things. This was an 81-year-old gentleman in Australia. He was going in for a knee replacement. He got put on the waiting list. We talked to him about going gluten-free, cleaning up his diet, and also just looking after himself in certain ways. And 7 months later, his cartilage had started growing back. And so he was told by the time we went back 7 months later that he didn't need his operation anymore. So that's what the body's capable of, actually doing this and getting that done. Now, this next one is ultimately my most favorite part of talking about stem cells because it's the most visual and the incredible. So to show how stem cells work, stem cell process is invisible. If I took a stem cell and put it on my skin, or I put it in my liver, it would switch on the gene and it would become a liver or a skin cell, but I couldn't see it. It's an invisible process. So a couple of guys actually won the Nobel Prize when they attached a green fluorescent protein to an adult stem cell. And then all of those daughter cells were fluorescent. Okay, so it was a way of tracking what stem cells were actually doing in the body in research. So with these mice, what they did is they irradiated them to kill off all of their own adult stem cells. And then they were injected with an adult stem cell with the green fluorescent protein. Okay, so this is the mouse. This is normal daily repair. So every day we're losing millions of cells, and those cells are getting replaced on a day-to-day basis. So this is the contralateral leg. The second leg, which is the next picture on the other side of the body, what they did is they injected a cardiotoxin into the muscle to create muscle damage. And then they were having a look at it to see what would happen to the stem cells. Did stem cells actually go there in a greater number? And the answer is absolutely yes. Those stem cells went there and turned into brand new muscle cells. So it doesn't have to be a cardiotoxin. It can be any form of injury, like a thumb getting hit by a hammer, by lifting heavy weights. As you damage, your cells need repair. And that's what your stem cells are doing, and it showed it very clearly here. Now, so this is incredible. So when they actually sacrificed these mice to actually have a look at the cells themselves under the green fluorescent light, not only were the muscle cells fluorescent, but there was fluorescent brain cells, heart cells, liver cells. There was fluorescent spinal cells. There was fluorescent kidney cells. So it showed that the stem cell itself differentiated into all of these different tissues within the body. Again, just proof that your stem cell physiology is there to repair your body. Now, the third picture I'm going to show here just shows that with that extract that helps to increase your circulating stem cells, they did the exact same process, irradiated the mice, they injected the stem cell, and then they induced the cardiotoxin, but then they gave them an extract of this herb that increased the circulating stem cells, and this was the repair when you activated your own stem cells, or when they activated those stem cells through a plant-based extract. Again, it just shows that if there's more damage and you can increase those circulating stem cells, then this is what happens with your body. It just wants to repair. It wants to repair itself faster than as fast as it possibly can. And one of the things in a lot of research shows that scar tissue can only form in the absence of stem cells. So with my surgery, I did everything I could. I recovered really well because as I repaired faster, I had more circulating stem cells, or I had better stem cell physiology. My scar tissue was lower, so therefore my overall recovery was better. Now, keto carnivore. I had to put keto in there because there's meat-heavy keto people out there, and it's really great to see. So the question is, are the keto and carnivore diets actually healing themselves? The answer is, there is no magic ingredient in meat that just makes your body work better. Inflammation blocks the signaling. Now, whether it be inflammation from seed oils or carbs, whether it's sugar whether it's plant toxins, oxalates, or highly processed food, all of these things here disrupt your stem cell physiology, which means your organs and tissues don't repair the way they should. Okay, so when we reduce all of these things, the processed food, the sugars, the carbs, the oils, this system works properly. And when this system works properly, our body works properly. And we repair and we regenerate. And in a lot of cases, as you've seen, we actually start to reverse what we would consider age-related diseases, because through the typical thing of an age-related disease, you'd think, oh, normally people at this age would get it, but they're getting it at that age because they've been eating this bad diet. And generation after generation, probably not that many, but they're eating the bad food, so that they tend to accumulate this. But as soon as people start to shift their diet, improve their stem cell physiology, they can reverse these and go back to a proper aging curve. And this is where we see people at 75, 80 years old, really, when we think about the basic biology of it, we should actually, when you see someone who's 80 years old, that's what you should look like when you're 90 or 95, if your body is repairing itself the way it should do. And in summary, the carnivore and meat-heavy keto diets help support stem cell physiology. That's that.
Yeah, so due to lack of inflammation is what you're postulating there. So it's interesting. I was going to ask you, as far as, has there been any examples where people have gone and shifted diets and seen like measured stem cell function? Has that ever been done?
Not that I know of. Okay, so I don't know if there has been a test, but it's definitely something to definitely look at, because I think that when someone changes one thing, or when a vast number of people change one thing, and there's a wide variety of those changes in health in a number of people with all different conditions, we can't just go, oh, that's because this one measure has changed, because then that would affect that one condition in that one person. So if you're changing and improving stem cell physiology, so it might not be that you're actually increasing the circulating stem cells with diet. It might be that you're reducing all of that inflammation and allowing for that communication to work better, which ultimately gives you a better result.
Yeah, I'm just going to relay a question that's in the chat here about fasting. Does fasting have any role in either the production, the release, or the function of the stem cell? Or are you aware of anything that would indicate that?
Yeah. So any type of eating does create a certain level of inflammation in the body. So just fasting is going to do that. Fasting is also going to increase the autophagy. I think that's how you say it, isn't it? So it's going to increase that, which is going to clean the field, if you like, and allow those stem cells to work just that bit better.
Now, your talk was talking about adult stem cells, the stem cells that you and I have as adults, and there are some people that they do injections of basically fetal stem cells. They'll take cord blood, or they'll take umbilical blood, or blood from human fetus-derived tissue. And can you talk a little bit about why one would want to do that or not do that, or what's the disadvantage, advantage of those things? Okay.
So the embryonic stem cells is something that I wouldn't want to be doing myself, because I know about the normal stem cell physiology of the body. If you can use a cord bank and put aside your own stem cells, or your parents put aside your own stem cells for your own use later, there's a field for that. But using other people's stem cells, then you get the problems like rejection and having to be on anti-rejection medication and things like that. There's definitely to and fro of what the results would be versus potential side effects of doing that.
Now, you had mentioned earlier in your presentation when you look at the mouse muscle repair due to the stem cells. And my understanding is our muscle tissue is about 1% to 2% of it's turning over on a daily basis. So there's quite a bit of activity going on. You'd mentioned that someone had added a plant-based herb or something, some sort of stimulant.
Yeah.
What was that, or do you know, or is that something that is useful in messing with?
Yeah, so there's an algae from Klamath Lake, Aphanizomenon floss aqua, and there was a double-blind, placebo-controlled crossover study that was published in a medical journal in 2004, I think it was, about 2004, and it showed that a specific extract from that plant actually stimulated the increase of circulating stem cells by 25%. And it was actually that compound that I actually used with all of my dengue fever. I found that supplement on the internet somehow, I don't know how, but I came across it and I researched into it and looked into it and started using that. And when I look at what my health had done, I had saturated my body with nutrition. I'd done every supplement, all the juicing, the dietary stuff that I could do. I had a whole house filtration system to get the best water I could possibly get. I was trying to exercise to breathe and oxygenate all my body, but nothing did anything to improve me. Overall, I would have been improved generally, but I still had all those gut symptoms. And it wasn't until I started increasing those circulating stem cells that my body could actually repair the gut and the liver to a point where it overtook the damage that was being done. So I likened my gut as it had a big scab inside it, a big wound. And every time I ate food, it would scrape that lining off. And it would leave it raw, which gave me lots of pain, discomfort, and all of that. And the nutrition I was putting into my body wasn't enough to actually support that repair process. So when I started to actively support my stem cells, they then came in and they could repair faster than I could undo the damage, or faster than I could do damage. And over about a 3-4 month period, my gut healed, my liver improved, and that was sort of the end of that.
Interesting. We've gone through an hour. It's amazing how quick it's gone through. So is there anything else you wanted to add on this, or any other thing we need to learn about or know about before we wrap this up?
No, I think that, pretty much everything I've said through that presentation hopefully was straightforward enough that people get a real idea of how the body's actually repairing and what it's doing with itself.
Yeah, so just a good diet, good sleep, manage stress, exercise appropriately, and I can't remember if was there another factor in that I missed? I think. Yeah,
you just avoid toxins.
Toxins, yeah.
Yeah.
Okay.
Yeah.
That's fascinating. I'm interested to see, in my own journey, if I end up doing some stem cells, which is interesting I didn't realize the amount that was in normal day-to-day circulation. So it's good to know. Yeah. And then I guess what makes them, why are they more sticky? Why do they not leave the marrow as easily? Or if they're being depleted, that's something that maybe, I'm sure there's a lot of people that have interest in that. John, thank you very much. It's always good to talk to some Kiwi folks, as it brings me back to the time I used to live there. And one day I get back down there and see how things are going. So thank you so much, John.